Hi, I'm Dr. John Boomgaarden, President of St. Joseph's College of New York, and I'd like to welcome you to St. Joseph's College, Living Our Mission. Thank you for joining us. In this program, we'll be discussing our experience during the COVID-19 crisis and our focus on health and wellness. In an effort to protect the health and safety of the SJC community, we temporarily closed our campuses down in mid-March. At the time, there was still so much unknown about the virus, but we were committed to doing our part to help slow the spread. Together, we have all had to learn how to cope and how to preserve our mental health and well-being. To speak more about this today, we have Dr. Joanne Durovich, PhD, Assistant Professor and Chairperson of Human Services and Director of SJC's Institute for Attainable Homes, and Dr. Maria Fletcher, Director and Associate Professor of Nursing. I'm so happy to have both of you here. Both of you have been great supports and have offered so much advice and help to the college during this time of crisis, and we're so fortunate to have both of you. So today's program is about COVID-19 and approaches to COVID-19, but it's also about your personal experiences as professionals who work at St. Joseph's College and are so important in the lives of our students and our staff and our faculty. So Joanne, from a human perspective, as the crisis hit, can you describe to the viewers a little bit how that impacted you and your teaching and your interactions with the students as you shifted to the new modalities?
Sure. It's certainly undeniable that with the onset of the pandemic, we had to do things in new and just unanticipated ways. We immediately, in a span of a week, we had to switch all of our classes to online. Many of our students were taking classes both online and in the classroom. And in part, they enjoy the classroom learning. They enjoy their interactions with the instructors, but also with their classmates. So as we shifted online, so did their employers, so did in cases where they had caregiving responsibilities, so did their children, being at home, being homeschooled. So all of a sudden, our students were balancing just an enormous amount of uncertainty, not only the pressures of just managing their schedules and having everybody at home in their household and being limited and not knowing what was going to happen next, but also the uncertainty and the fear of being sick themselves or having an ill family member and having to worry about that. So the mental health strain for our students and our faculty was really, really overwhelming. And what we found was being flexible, focusing on the role of community. We know that the Sisters of St. Joseph has a long-standing tradition of really caring for our community and caring for our neighbors as we would ourselves. And that really gave us something to fall back on in terms of reaching out to students. Yes, I wanted them to learn the materials that we were covering in class, but I also wanted to know that they were okay, that they were managing. I can think of a couple students that were dealing with cancer and going through chemotherapy while also having to deal with this. And they would reach out to their faculty really for that interaction and to be part of a community. The isolation, the profound impact of isolation on the mental health of our students is something that I don't think we can really underestimate.
How does it manifest itself in your experience with the students so far?
We're seeing students, in my own classes, I would see students reach out and ask for advice. They would ask for phone calls, with students that would otherwise come through to office hours. They would ask for phone calls. They would ask for individual video conferences. I would schedule, even for my classes that were online, I would schedule voluntary Zoom meetings just to check in, and they would all come. Mm-hmm. I don't think there's been a time in my career where there's 100% attendance at all times, but when we would schedule these meetings, and they would have their children in the background or their pets in the background, or they'd be sharing a computer, but they would show up because they wanted to check in with each other. But that isolation, I can't tell you how many students in Zoom meetings would just break into tears because they're worried about a loved one, because they themselves have been ill, or they haven't heard from a faculty member and they were worried about them. So it really manifested in all kinds of ways. And again, the material they're learning in class was really important, but everything else really had to take front and center because everyone is in such a fragile state right now and so uncertain for the future.
Yes. I think that as president, one of the sad things I had to do over the previous months is I had to write many condolence cards. We lost a number of people in our extended community. And because of that, we had to deal with a lot of grief. But I think, Joanne, you put your finger on something that's a real issue for all young people, even without a COVID epidemic, and that's the sense of alienation or isolation. So in a way, being able to reach out through technology has allowed them to at least express some of those feelings and work with them.
Absolutely.
Right.
Absolutely.
So Maria, what about you? I mean, as the director of our nursing programs, how were you impacted in your teaching and in your work by the arrival of the virus in March?
The Department of Nursing was greatly impacted. Literally overnight, we were not able to have face-to-face clinical experiences. All of the hospitals, all of the long-term care facilities immediately suspended student learning in their institutions. Rightfully so. That was a good decision on their part. However, we're constrained by certain regulations that students needed to have significant amount of hours to complete. And how are we going to do that? So very quickly, we had to move not only from a face-to-face meeting with students to a remote because of college mandate, but we also had to find out how we could service the students in ways that they wouldn't be penalized. That's both the undergraduate and graduate students. We partnered with one of our publishers who was able to give us access to virtual simulations, vSim, so that students on their clinical days would have the experience with their instructor to prepare for and interact with virtual clients. That was a real shift in modality for us because we've never done that. We couldn't bring them on campus for the simulations, and we have wonderful labs, but we couldn't utilize them. Overall, though, I think that the transition went well. There were, like Joanne has mentioned, many issues that needed to be addressed, and we did. Faculty was much more open to giving out their cell phone numbers so that students could contact them at any time, not having to wait for an email response or for a Zoom meeting. But also, I think that students understood that they could gain a meaningful experience with the simulation, and they did. I did exit interviews of our now graduates, and they all had high praise for vSim. Is that what we want to do? No, but it's now offered us an alternative, which we had not been able to look at before, and will make learning at least effective. Not terribly effective, but effective.
Not perfect, but effective.
Not a perfect,
right?
but
which is, the case in many medical situations, right? So for both Maria and for Joanne, you're teaching students that are going to be working in the health professions, working with people on a daily basis. Has this experience given them, the students, any new insights into their professions and their careers, you think?
I think that everyone who's in our nursing program sincerely wants to be a nurse. This just reinforced their intent on a career path. So that what I've heard from students, both during the spring semester and all through the summer, is how this is what they want to do. They want to be nurses. Many of them worked as aides in hospitals, continued to do that during the COVID crisis, and really saw that as wonderful experiences for when they were the nurses that were giving the care. But we've also had a tremendous interest from people who are not in our program who want to be nurses. So I think that the whole COVID-19 had a positive effect on people thinking of nursing as a wonderful career path for them. Fortunate for us that we have the students, but for others who are now really drastically looking for spots in our program as well as others. That might be one of the positives.
It's also impressive. I have sometimes this conversation with people who aren't around college-age students much. What's wrong with young people today? Where's their work ethic? Why aren't they doing more? And I have to say, and I say this to all of them, you need to spend more time around them, because I think you'd be surprised and very impressed with not only how hard they work, but their heroism. In the case of our nursing students, of going out there and maintaining those positions, and then even desiring to continue as nurses and bringing more young people into the program is truly heroic. And I think that it really speaks well for young people And I think that everyone in the country should have a sense of positivity about the future when you look at how our young people are dealing with it. Joanne, what about the students in your program? Tell us a little bit about them.
So much like Dr. Fletcher, many of our students were out interning, doing their field work. They were working in places like homeless shelters, senior citizen facilities, food assistance programs. Many of our students go on to go back to grad school and become social workers. And they just, even now, much like nursing, the field of social work and human services more generally has had to find new and innovative ways to reach people who are in need of help. Because one of the things that we know about the current pandemic is that many of us are experiencing all kinds of mental health issues in terms of depression and anxiety. But for people that are already at risk, so they may already be isolated, they may already be sick, they may already have limited resources, those people are even more at risk. And I watched our students find creative ways to keep themselves safe, yet provide services to some of our most at-risk community members. And they've already, I hear back from them, they're already starting graduate school, they're becoming social workers, they're moving, they're going out and moving on with their careers and taking this situation and learning how to help people in creative ways.
So in a sense, the crisis has helped all of them to better identify their real vocation.
Absolutely.
When we talk about education in life, many times, I talk a lot about this with students and with faculty too, about finding that vocation. And the vocation may not be exactly what you think it is, but sometimes a situation like this really clarifies it for you. And you say, this is a meaningful thing to do with my life, and it's so important. And we talk a lot about this at St. Joseph's, about to be and not to seem, right? So our students are really doing these types of things to help their community, help one another. And they're not just here in school to get a certificate or a diploma, but they're looking at a bigger picture here. They're looking at some kind of a vocation that is going to give meaning to their lives and also make the world a better place. So it's the projection of the college into the community through these health professions programs that we have at St. Joseph's that are so powerful. Well, we're going to take a quick break. When we come back, we're going to talk more about coping with COVID-19. Thank you. Welcome back to St. Joseph's College, Living Our Mission. We were discussing the importance of mental health and well-being during COVID-19. Joanne, I wanted to ask you, as you look out at the landscape, we've talked a little bit about our students and about our college, but if you look out at the larger landscape of Long Island and beyond Long Island in New York, what are some things that communities should be doing as we come through this crisis and hopefully out of this crisis?
I think there are a lot of things that communities can be doing. One of the things that we've learned just in terms of the mental health impact of this is the isolation has a profound impact on our communities. And I think what we've learned, maybe the silver lining to all of this, is that we're all part of a community, a variety of communities, whether that's the St. Joe's community, the neighborhoods we live in, the churches or religious institutions that we attend. And I think we've learned to find new and creative ways to reach out to those communities, whether we need help or if we're able to offer help to someone else. Just checking on your neighbors. I remember I had an ill neighbor and I simply called and said, I'm going grocery shopping, can I pick things up for you? I had another neighbor going through chemotherapy, and the same thing. People were delivering groceries when somebody wasn't able to get out of the home. So identifying people who are in need, which is really what human service professionals and social workers do, identifying people in need and then finding creative ways to meet that need. And anyone can do that. We as professionals, that is what we do. And unfortunately, this situation has given us an opportunity to do that in creative ways, but also making sure that we're reaching out to our neighbors and checking in on them, but also that we're reaching out if we need the help. It's very hard for many people to ask for help, but there are a lot of people out there that want to provide that assistance, and it's just a matter of making your community know that you would benefit from some interaction and some supports.
Well, before I came to St. Joseph's, I was for 5 years the Dean of the College of Music and Fine Arts at Loyola University in New Orleans. And I was in New Orleans immediately after Katrina. And one of the things I saw there was tremendous depression that was brought on by living through such a crisis. Even though the crisis was gone, even though the buildings were being reconstructed and things were starting to look better, the damage to people's psyches was profound. Do you think we'll have a similar type of effect in the entire nation because of this crisis?
You know, I do. I think I'm as invested in this as anyone. We all want to go back to normal. How many times in a day do you hear, let's go back to normal? When do we get to go back to normal? And I think what we're starting to realize is that it's going to be a new normal. Mm-hmm. And we're going to define our communities and how we interact in communities and the kinds of things that we engage in a little bit differently. Mm-hmm. And things like trauma, because this is a collective trauma mm-hmm. that we are all as a nation going through. Things like trauma impact the way you see the world and the way you navigate through the world. But you can recover. And it's interesting that you bring up Katrina, because I happen to have school-age children, and I listen to a lot of parents very worried about what's going to happen with school when they go back to school. And I often give the example of Katrina, that there are children there that missed a year of school, and those children grew up to become doctors and nurses and social workers and police officers. We will recover, but it's a matter of investing in our communities, investing in our neighbors, asking for help when we need it, and providing help when we're able to.
There is a kind of transformation that occurs when you experience trauma, which is you never look at the world quite the same way, right? So even though we may come through the crisis, there's still going to be the scars left from that. And so the physical may be improved and may look great, but that scar is still going to be there for people. And I think that, you know, all of us here at St. Joseph's are thinking about the future and ways that we can impact in a positive way the future. And certainly, you know, we have wonderful programs right now in service of people for counseling and for various types of human services. And I know that's an area that we're going to continue to grow in the future. So I'm not going to say a lot about that, but I'm just going to say that we're working on that, because I recognize as a president, that's a really important aspect of our mission as a college, is to create young professionals that can go out into the world and have that kind of impact. Maria, when you think about your nursing program and also programs across the country, how do you think this crisis is going to affect the medical professions across the entire nation?
There will be changes, and I think there will be some good changes. As far as schools and departments of nursing, we're going to be looking at more closely the role of something like simulation in educating nurses. There's a lot of research about that, some research that's being done right now, but there is benefit. There is effective learning that occurs when you have simulation. So I see that that is going to become more and more part of the curriculum, as opposed to just saying you have to do 105 hours in a hospital or a long-term care facility. Those are good changes. We can reinforce teaching maybe better that way than we can when we're in a live situation. I think what will also happen as far as healthcare, and that we in education need to respond to, is the role of telemedicine. The concept of telemedicine is not a new one. It's been around for a long time. However, I think the pandemic emphasized the effectiveness of having healthcare provider meeting with patient over a virtual environment, and that it was effective, that people liked it and they responded to it. In education, then, we have to make more of an effort of including that in our programs. It's a little bit harder undergraduate, but we will expose them to it. For our graduate students, definitely going to be a priority, because for our nurse practitioner students, for example, they will be the healthcare provider with that patient in a virtual environment. That is a good thing, and we need to respond to that. There may be other changes, and I think they will be in the form of leadership. Many see that the pandemic emphasized the critical role of nurses in the delivery of healthcare. As nurses, we always knew we were critical to the success of any patient experience, whether in the hospital or in the home. The pandemic really emphasized, focused on that. We need to do even more in educating our nurses how to be good leaders, how to be creative, innovative leaders, so that they can take a situation, be flexible about it, come up with new ways of delivering care. And we also need for them to be vested in critical judgment. And we will do that. We're being mandated by NCLEX in a few years to emphasize that more, because that's how the exam is going to go.
NCLEX is, for our viewers.
It's the national licensing exam for nurses, a national one. And I think those are all good directions. And now we need in education, and we've begun that at St. Joseph's and other colleges as well, to look at that and say, how can we educate our young novice professionals so that they are as effective as they can be in delivering optimal care to the patients that they serve, wherever they serve them.
Well, I think that's a huge transition for the place of nursing, if you think about it, because the first thing you mentioned is that this virus has accelerated the use of technology and the use of new technologies, and the new nurses and the faculty as well have to learn how to use all of this new equipment, because it's clear that should we have another recurrence of some other type of pandemic, then all of these things will have to be called into place again. And also they've become the new normal in a way for nurses, so that working with extremely complex technological equipment may become more and more common. So it's yet another additional area of learning for nurses. And then you mentioned the other one, which is the importance of leadership and management for nurses. I know that I've had this conversation with hospital directors too. I've said, what is it that you would like to see from the nursing students from St. Joseph's? And of course, by that I could say all nursing students that you see. And the response has been several times, we need them to have better training in management, because they're not just managing patients, they're managing one another. They're essential personnel in the hospitals doing so many different types of tasks now. It's become so much more complex. And so for St. Joseph's then, our job is to provide the nurses with that kind of breadth of education, right? And I think actually that we're in a good position to do that because of our tradition, right? We're a school that focuses on the whole person. We focus on not just educating them in nursing and science, but they might even take a roots music class, or they might take a class in counseling, or they might take classes in arts and literature to make them a more rounded person, but to give them the kinds of skills they need to be successful. Right? It's fascinating that even though this crisis has been so horrible, there have been good things to come from it. And one of those things is the recognition that the college is really got an important mission. So we have a mission, and that mission is to go out and transform the world for the better, and doing that through the health professions in particular is something that we excel at. So we've had great success with our nursing program. I know that we recently were reaccredited, and I'm so excited about the progress we've made there. I'm very excited about the future of our counseling programs and our human resources programs. So all of these things flow beautifully into who we are at St. Joseph's. So despite the darkness of the crisis, I think we've been able to create from that an opportunity for our students to learn even more. As both of you look back at this, how would you assess the future as you look at the incoming students that you're seeing right now? How do the numbers look? How are things looking? Because people are going to probably want to know that.
Our numbers, thankfully, are very good. In some of our programs, especially the graduate program, we've had to turn away students. Not good from the student point of view, but very satisfactory, or a good place to be in the nursing department. Even our undergraduate program, we're at capacity now, and those are all good things. We're actually a little bit higher than capacity, but we'll deal with that when the time comes. I think that the educational institution, in this case St. Joseph's College, offers a safe environment for students. they know or should know, because our faculty and our administration has been so focused on telling them that they have a safe place. They have people who will respond to whatever their needs are, whether they're personal, educational, financial, and they can do that. And I can't imagine a better place to be than in an educational institution, and of course, St. Joseph's College, in the next year, as we're navigating all of these uncertain waters that we'll be faced with.
Well, I want to thank both of you for the incredible work you're doing. I know both of your programs are doing very well this year, and we're extremely optimistic about the future. I think that as we look into the future for St. Joseph's, we can clearly see that the health professions are going to play an increasingly important role, and I'm extremely excited about the future of the college in this area. And I thank both of you today for joining me.
Thank you.